Okay, this video is about my Prevent and Reverse Disease books. I made a whole series of them. There's 10 of them. They're all available on Amazon.com. The way this happened was I wanted to write like a second edition of the Medical Reformation, my big book where I rewrote the internal medicine textbooks. And my girlfriend, who's now my wife, she said to me, "Oh, don't do it. Nobody wants to read your big books. They're too expensive. People don't care. All they care about is their own disease. Just write a small book for each individual disease. That's what people want." So that's what I did. It's a lot easier for me. I can write a small book, 250-page book in about 2 months pretty easily. Okay? Because I've given so many video lectures and I've written so many book chapters. I mostly just take one of my videos and I transpose it into the book. That's how I can write it so fast. I can write 60 pages in a day. And then also, I do them a certain way. I have a lot of color pictures. I always have a color cover. I have color pictures inside. I have color-coded text to make it easier to read. I'm trying to make the book good. And the reason that matters is people get pissed off at me too because the books are a little expensive. The average price would be something like around 25 bucks or something. And I'm like, okay, fine. It's a little more expensive, but it's good. I'm not trying to mass market a copy. I realize very, very few people are going to read these books. They're for like the smart people. I kind of believe I'm an elitist. I do not believe in equality at all. I think the vast majority of people are stupid. They have no hope whatsoever of being cured. They're going to be on drugs and surgery the rest of their life, and they're going to have terrible outcomes. I've been a doctor 35 years. The cure rate for hypertension with pills is 0. Diabetes, 0. Okay, you're not going to cure obesity with a pill. You're not going to cure AFib with a pill. You're not going to cure any of these diseases, autoimmune disease. So these are like for the rare individual. Maybe the top 20% have a chance at this, to read and to change their behavior. The vast majority of people are like as stupid as an animal, okay? They will not read a book. They will go for open heart surgery, craniotomy, anything, rather than read a book. I've seen it. I've seen it all my career. So I don't even consider my books or my website for them. It's for the people who are unusual, the more intellectual, the ones that think and use their brain. What can I learn? Maybe I could get better on my own. Because, it's easy to cure obesity, hypertension, diabetes, coronary heart disease. The earlier you catch it early, you cure it 100%. But this is not known by physicians, and very, very few people read. The vast majority of doctors I know don't ever read. Okay, it's weird, but reading is a rare thing. You're dealing with an intellectual when you deal with somebody who actually reads books. Okay, so anyways, I'm writing for them, not for all the dummies. All right, so real quick, we'll just go through the books. You already know them if you know me. Prevent and reverse obesity, prevent and reverse hypertension. These are easy to cure: hypertension, obesity, diabetes. Prevent and reverse diabetes. Prevent and reverse congestive heart failure. You can't always reverse CHF, but there's lots of case reports of CHF being reversed, and Kempner was reversing it. And AFib, lots of times you can reverse. You can't always reverse it, but a lot of times you can. Why not? You can prevent it from coming back if you've already had an ablation or something. Prevent and reverse stroke and heart attack. Okay. Prevent and reverse kidney disease. A lot of times you can't reverse kidney disease, but you can at least slow it down. You can often slow it down dramatically like Kempner used to do, etc. Keep these patients off of dialysis. Dialysis death rates 50% in 5 years. Prevent and reverse dental disease. Dentistry is a disaster. Dentists don't know what they're doing. They're not trained at all in toxicology, and their composites are often 45% aluminum. They're from aluminum hydroxide. Their amalgams 50% mercury. They're poison, okay? Dentistry is a disaster. The more you learn about it, the more careful you be with your teeth. Here's autoimmune disease. Typical autoimmune rheumatologist doesn't know leaky gut. I talk to medical students all the time. They don't know what leaky gut is. It's like the most basic thing. And there's tons of things related to leaky gut, not just autoimmune disease, molecular mimicry with autoantibody cross-reactivity. There's also all this, amyloid clotting. Major big deal for cognitive decline, atrial fibrillation, etc. Okay, iron overload, all that stuff. Prevent and reverse Parkinson's disease, chronic fatigue syndrome. So I wrote all these books. I figured this stuff out better than anyone else in the world. And it's sort of like, my attitude too is like, look, you're willing to pay, $20,000 for a surgery. You're willing to pay, $150 every month for a medication, but you don't want to buy a book because $25 is too expensive. Well, then you're a stupid idiot, so I don't really care. I just wanted to write the book so the information's out there, keep the knowledge alive, so that there's hope for mankind, that some people will at least develop their minds and somebody will know what's going on in the truth. I realize the truth is always going to be hidden by information flooding with nonsense like the high-fat phonies, like all the drug dealing, conventional medicine, dealers rather than healers. I know that, but I'm making this available, so for the few who want it, it's there. I think that's it. Yep, that's it.